Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and today we are going to look at aortic valve disease. What is aortic valve? How does the aortic valve get damaged? What are the causes of aortic valve damage? How does a damaged aortic valve look? How do we diagnose aortic stenosis? What are the complications? And how we manage aortic valve disease as cardiologists. I'm a cardiologist and I have been in practice for more than 30 plus years. I have practiced at the Texas Medical Center. So let's look at some aortic valve. Okay, here is a picture of a heart showing the aortic valve, which is circled in the middle. The aortic valve separates the left ventricle from the main aorta that distributes the blood to the rest of the body. The aortic valve is really thin. It's almost like paper thin, and it has three cusps. As you can see in the picture to the right of the heart, there are three cusps which are open at the top and closed at the bottom. And occasionally some people may be having only two cusps, and that's called as the bicuspid aortic valve. And this is how it looks when it is open, and in the bottom it just how it looks closed. People who are born with bicuspid valve are more prone for infection of the bicuspid valve, and with age they can develop calcium deposition, which can lead to aortic stenosis. Aortic stenosis simply means narrowing of the aortic valve. So in other words, aortic stenosis simply refers to the buildup of calcium and debris on the leaflets, which make them thick and they stick together. As a result, the opening becomes extremely narrow that interferes with the flow of blood from the left ventricle into the aorta, which is the main artery supplying the blood to the rest of the body. Let's look at some abnormal aortic valve. Here is a normal aortic valve opening. In the bottom, we can see an aortic valve which is thickened. You can see the leaflet's edges which are thickened, and when they close, they may not close properly. Sometimes these edges are kind of stuck together, so the valve leaflets don't move as they are supposed to move normally during a cardiac cycle. Narrowing of the valve opening is called as the aortic stenosis. I already talked about what causes. Generally, this is seen in patients who are in their 6th, 7th, or 8th decade. It is a degenerative disease. Because of the wear and tear, the leaflets get damaged, and there is deposition of calcium, which leads to thickening and also reduced opening of the aortic valve. What are some of the symptoms of patients with significant aortic stenosis? Patients can have chest pain due to reduced circulation to the heart muscle itself. They can have palpitations due to irregular heart rhythms. They can have dizziness because of reduced cardiac output. And occasionally, people can pass out, and sudden death is one of the other symptoms of aortic stenosis. And here is another example of a heavily calcified aortic valve. It looks like almost like a rock, cutting through a rock. And look at the normal valve, which is real thin, it's smooth, it's glistening, and it moves very freely. Compare that with a stenotic valve, and you can see the big difference. How do we diagnose aortic stenosis? When we listen to the patients, we can hear a real rough murmur. It's called the ejection systolic murmur. Basically, it is happening during the time the ventricle is ejecting the blood into the aorta, and that is during the pumping action of the heart, which is a systolic phase, and that's why it's called the ejection systolic murmur. Murmur basically means turbulent. This murmur can be heard very easily in the second space on the left side of the chest, or it can be heard throughout the entire heart region in the left side of the chest. Sometimes the sound may be conducted to the neck, which we call it as bruit, or the conducted bruit that is commonly heard on both sides of the neck. The most definitive way to diagnose aortic stenosis is by a 2D echocardiogram or an ultrasound, as it is called. And here is an example of an ultrasound where we have put a continuous Doppler across the aortic valve to look at the pressure gradient from the left ventricle to the aorta. And we measure the velocity of blood flow, and from there we extrapolate the gradient in terms of millimeters of mercury. And as you can see, in this tracing we have 93.34 millimeters of mercury. So that is suggesting significant or critical aortic stenosis. And sometimes we may see milder degrees of gradients across the aortic valves. And this is used as one of the criteria to diagnose the degree of narrowing of the aortic valve, and then based on that we make decisions as to what needs to be done. Do we follow the patient medically? Does the patient need surgery? Does the patient need like a procedure, interventional procedure? And that we're going to talk about in a minute. And sometimes the probe is put through the foot pipe, that's known as the transesophageal echocardiography, to get a better understanding of the heart valve itself, because the probe is in close proximity to the aortic valve and the aortic leaflets. So then you can get a much better picture of the heart and the heart valve. Okay, here's an example we talked about. Okay, based on the degree of narrowing, based on the amount of gradient across the left ventricle and the aorta, we classify the degree of aortic valve narrowing as mild, moderate, or severe. In a person with, say, no stenosis, that's a normal person, has an aortic valve area of 5 to 6 centimeters square. There should be no gradient across the aortic valve, and generally the velocity of the blood is approximately 1.5 meters per second. In a patient with mild stenosis, the valve area could be considerably reduced to almost 1/3 of the normal aortic valve area. The gradient may be anywhere from 20 to 25 millimeters of mercury, and the velocity can vary from 2 to 2.9 meters per second. And in a severe case, the valve area is like 0.6, that is like almost 1/10 of the normal area. And you can imagine if the blood flow across the aortic valve is 1/10 of the normal, that can tell you how quickly you can get symptoms. And the gradient is generally more than 60 millimeters of mercury. In the Doppler study, which I just showed you, the gradient was 90 millimeters of mercury, and usually the velocity is more than 5 meters per second. Let me go back here for a second and show you. Okay, as you can see, here's 2 meters and 4 meters and 6 meters. This is almost like 5 meters per second velocity. That's why it is translating into 93 millimeters of mercury gradient across the aortic valve. What are the complications of aortic valve? Why do we need to treat it? Well, some of the complications related to aortic valve are, as I already told you, palpitation, chest pain. People can get heart attack from the valve. But most importantly, people can feel dizzy and pass out. And in very rare conditions, when you have critical aortic stenosis, especially with physical exertion, they can develop serious arrhythmias, and even sudden death has been reported in patients with aortic stenosis. So anytime the valve area gets moderate, then we need to closely monitor and repeat ultrasound test every 6 months to see if there has been a progression in the gradient across the aortic valve. But when we get to a valve area of 0.6 or below, then the treatment is surgery or intervention. In surgery, a porcine valve such as this, shown in this slide, is put in place of this stenotic valve. First they cut out the stenotic valve, then put the ring in that place, and then suture the valves in place. That is a surgical approach. More recently, especially in real debilitated patients, there is a new procedure which is called the transcutaneous aortic valve replacement. And this is how it is done. A wire is passed through this stenotic aortic valve, and over that a balloon is used to compress and break the old calcified plaque. And after it is compressed, a second catheter with an aortic valve mounted on that is moved and placed in position, as you see in picture C, and then the valve is expanded, as you see in diagram D. When the valve is expanded, it sort of plasters to the aortic valve, and it serves the same function as replacing an aortic valve with a full-blown surgery. So these are some of the techniques by which a patient with aortic stenosis is managed. And when you get a porcine valve, you need to be on blood thinners for approximately 3 months. After that, you do not need to be on any blood thinners. Well, ladies and gentlemen, this is a brief summary of aortic valve disease, how aortic valve disease manifests, how we diagnose aortic valve disease, and what are the treatment options available for aortic valve disease. Okay, I am back. I am Dr. NIK NIKAM. I'm a cardiologist. I've been practicing in Houston for 35 years. I hope this has been useful to you. And if you would like me to educate you on any topic in the field of cardiology, please leave comments below, and we will be happy to create a educational video for your purpose. And for that reason, we would like you to please do subscribe to our YouTube channel, and we also have a Facebook page which is Triple N Media. We would like you to visit our Facebook page and like it. Until next time, I am Dr. NIK NIKAM for Triple N Media, and have a wonderful day. Thank you so much.